All right, so you are joining us today for the online and residential Masters in Public Health information session. We're specifically going to be talking about health policy and management, which is a division within UC Berkeley's School of Public Health. And there's different ways that you can pursue health policy and management through our online format or our residential format. So in our session today, we'll be introducing ourselves in just a moment. We'll talk about the benefits of pursuing a master's in public health here at UC Berkeley. We'll do an overview of the online master's in public health program, and we'll also do a bit of an overview of the residential master's in public health program. That way you can sort of compare and contrast the various options available to you. All right, and we can dive into some introductions. I can start. My name's Elise Rudolph. I'm the Director of Online Admissions and Recruitment, specifically with OOMPH, as we affectionately call it, the Online Masters in Public Health program. Bradley, would you like to introduce yourself?
Yeah, thank you. So hi, everybody. My name is Bradley Jong. I am the Senior Program Manager with the Health Policy and Management Division. And I work with all the students who choose to pursue their MPH in the on-campus space. And I'll turn it over to Stephanie.
Thank you so much. I am Stephanie Nguyen. Thank you so much, everyone, for joining us today. I'm the Online Education Recruitment Manager, and I specifically support the online prospective students and applicants through their journey. I know that Lori is not on this slide here, but she is a part of our admissions team for the residential program, and she's on the call. Lori, sorry to put you on blast, but if you just wanted to quickly say hi, would be happy to highlight you.
Absolutely. Thank you. Hi, everyone. My name is Lori Nalbandian. I use the she, her pronouns, and I have the honor of serving as the residential admissions and recruitment manager here at the School of Public Health.
Awesome. We are a very connected school and just wanted to highlight all of the folks that are going to support you throughout this journey. I will send this back over to Bradley.
All right, thank you. And so to give you a kind of a lay of the land for our session, we're going to start at a Berkeley high level. So UC Berkeley wide, just and kind of the community that you would all be joining, whether it be online or in person, just knowing that you would be a UC Berkeley graduate student here. And so there's numerous Berkeley public health events, and you can see a little flyer of all of the great things that and honors that our faculty have been notified and alumni have been awarded. And there's a lot of growth within our Berkeley Public Health, and especially in the HPM faculty. We just hired 2 new faculty, or actually 3 recently, and one who just started this fall, who focuses on technology and AI. And we have a lot of different initiatives to support students in their professional development. We have the social impact team, as well as the RISE team, which we'll touch on later in this presentation. There's also a campus-wide focus on innovation. Dean Rich Lyons is Chancellor Rich Lyons is one of our newer chancellors, and who's been a big advocate, who most recently was our Chief Innovation Officer for UC Berkeley. And so there's a huge push towards how UC Berkeley can be the place for innovation. Next slide, please. And so there's a lot of different opportunities to get involved with public health here at UC Berkeley. For example, in the spring, there is a HOS Healthcare Conference, which brings together key executives and community members, faculty from all over campus that students are welcome to participate in. And really, it's a great networking opportunity. We also, most recently in the spring, had a Medicaid innovation competition, which was really awesome, hosted with our social impact team. And just a lot of opportunities where you could see even our dean talking about or speaking at the healthcare conference in Taipei. Next slide, please. And so here within public health, and most specifically in the health policy and management program, many of you may be considering health policy management, or you might be open and to various different pathways and emphasis that you want to pursue your MPH. And so for here, if you are considering or maybe leaning more towards the health policy and management, you'll benefit from the professional development, the engagement with our faculty. And because for a lot of our courses, there are case-based and service-based learning experiences. So it's not just theoretical, but many of our faculty involve outside clients that you're working on real world projects with, and you're presenting in front of executives. Last spring, we had the president of Blue Shield come, and their students shared about their deliverables with them. And so there's a lot of different opportunities available to you all, whether online or in person. And next slide, please. And so it's just to kind of highlight the curriculum at a very high level for health policy and management. We take a systems level approach. And so we look at all the different impacts that kind of encompass with health policy and management. And so students in our program take courses in policy, economics, finance, management, in addition to the general MPH requirements that you might see, such as epidemiology, biostatistics. And whether it's online or in person, many of the faculty who teach in person also are teaching the exact same lecture in the online space. And so you're getting the same tenure track, rigorous curriculum that students in the in-person also get to enjoy in the online space. Ultimately, our hope is that you see that whether it's online or in person, it's whatever modality best meets your needs in this current time, if you're deciding to pursue your degree now or maybe the next year or two. And also just that we also have a academic certificate in health management, which by taking 3 courses, students will get that designation to share on official transcripts that you have a academic certificate in health management. Next slide, please. And so you can just see some of the cutting edge research that our HPM faculty have led, such as Jamie Robinson, talking about industrial policy for life sciences. He teaches one of our courses, the biomedical life sciences policy course. We see some of our other faculty, Hector Rodriguez, who teaches the online org behavior course in healthcare management, who's part of our larger research center as well. Talking about financial incentives, it can improve equity in patient care. Next slide. And so just to kind of take a step back and just various ways that students can get involved, whether it be student government, Haas Healthcare Association, which is open to any graduate student across campus. There's different research centers and opportunities to get involved. What I hear from students is that there's too many options, too many opportunities, because being a Berkeley student, you gain access to such a powerful network that's just really exciting, that many students really get to enjoy. Even before they start, they're already making connections. All right, next slide. And now I'm going to transition over to, I think, Stephanie.
Yes. Thank you so much. And thank you for highlighting the many things that we offer at our university. So within the RISE office, they're actually a very critical component to your success here at the School of Public Health. So the RISE team, they're known as the Career and Leadership Office. So they are here to champion you through the practicum. They are here to help you clarify your goals and support you through your career journey as well, wherever stage you're at. So the top 3 buckets that I would say that they focus on specifically would be practicum support, so helping you with guided access to finding your practicum and ensuring that it meets the goals and competencies of our public health needs. Career planning in terms of support, updating your resume, CV, doing mock interviews, helping you network, bringing in people to highlight their roles and pathways into health policy and management and other neighboring fields. Leadership development, really unpacking what it means to be a leader in this public health space, right? We're public health professionals looking at different lens, taking in different ideas and working collaboratively together. And what happens when you're in a slump? What happens when you are in spaces where you're met with unique conversations and you're trying to figure out how to navigate that? The RISE team is there to support you, not just for our program and the duration of it, but the longevity. We actually have an upcoming workshop or info session with them in November. So I can plug that in a little bit later, but would definitely point out that they are such a critical pathway to your success within this program. And one of the exciting things about RISE is you get to start early with them. When you are enrolled into the program, you are able to meet with them and really build your network very early. So wanted to shout out RISE and all the amazing things that they do. I'm going to pass this back to Bradley to highlight another incredible resource, the D-Lab.
Yeah. And so with the D-Lab, just it's a very it's pretty seasoned now, but it's an opportunity for staff, faculty, and students to gain access to strengthen or learn about data, just how to apply data. And so there's data visualization. And so they offer numerous workshops. So perhaps maybe you don't want to become the data analyst or get to that level, but you want to learn the vocabulary. You want to gain exposure so that if you are presented with data or analysis, you know how to read it, you know how to interpret it. And so one of the things that in lieu of a class, you might be interested in taking workshops on campus. And so the D-Lab or the Data Lab, they host numerous workshops throughout the fall and spring semesters on to learn R, Stata, SQL, Python, Excel, Tableau, and so many more. They offer consulting services, for one, if you maybe have a project or need some technical support. Many of the folks there are PhDs or faculty supporting people who are interested in diving deeper. And so that is an opportunity open to all Berkeley community members. Next slide. And so just to kind of give you a sense about the interests and where alumni have gone, who have pursued health policy management, you can see digital health, payer health, product, global health, innovation, policy. There's just so many ways that our alums and students get involved, whether through practicum or just through coffee chats, and really broadening their network, whether it be consulting to more health plans, FQHCs, you name it. And so I think there's a wide variety of interests that students have within our program. And so we hope that you might see yourself here in these shoes, potentially maybe next year.
So I'll take over this next section here for the Online MPH overview and discuss some of the highlights of our program format. So our program is 90% online, 7 semesters long, and we require 2 campus visits. So there's a 10% in-person component. The type of degree that our students receive is a professional MPH. So one thing I like to point out is that this degree does not indicate that this program was completed online. You get the standard degree that our residential students receive. The commencement is also a universal celebration. So we all do it in-house here, and it's just one type of degree. The course delivery that our modality functions as is the lecture materials are provided asynchronously, so it's not live. They're pre-recorded, and we offer weekly deadlines attached with those lectures. The office hours are held in real time, so there's always opportunities for face-to-face interaction. So this can be through Zoom. Sometimes professors will also, or faculty will also host in-office hours. Those are things that we will ensure are available to our students. And another thing to highlight is that within the course delivery, it's a cohort model. So the students are working together week by week. There's a flow and a streamline into the way that our program functions. And our course model is pretty simplified in the sense that first-year students are required to complete 6 pre-assigned core and breadth courses. So it's a fixed model, meaning we will pre-assign the classes and let you know which classes you need to enroll in, so there's no guesswork with that. And it's an opportunity for you to explore your pathways. As much as we want you to have an idea of what you want to do prior to coming into the program, your interests may change, and this first year can give you an opportunity to explore a little bit and also gain the necessary competencies into your public health toolkit as well. So it's a very structured first year. Moving on to the second year. So this is where students will complete your concentration courses along with your elective courses. So you can step out of the health policy realm in terms of the elective courses and take a class in global health. You can do epidemiology and biostatistics, any of the offerings that we do have. So you can always meet with me one-to-one for an advising office hour, and we can discuss that in depth. But moving forth to the student services support. So our students are supported and paired with a program manager. So you're assigned by a program manager within your concentration. And you have a faculty advisor that is also going to be working very closely with you to provide program, academic support, and mentorship. So it's a very small community, and it's very much hands-on in terms of how we will support you and guide you to completing the program successfully. The average time commitment within our program is about 15 to 17 hours weekly, and this includes all of your deliverables, your reading assignments, your homework, any group participations, office hours, perhaps. And keep in mind that this is a part-time program. So that leads me to the next important note is that students in our program are typically enrolled in 6 units. So that totals out to 2 courses a semester. And I actually have a visual coming up to give you a better sense of what that looks like. But essentially, 2 classes over a period of 7 semesters. And it takes a minimum of 42 units that are required for graduation. In addition to this, our capstone is a comprehensive examination. So it's open book. We do a lot of prep work before we get to that point, but we close out with a comprehensive exam to ensure that you have truly understood all the materials and the frameworks to make you the most incredible public health professional that you can be. And I'm excited to lead the next slide to Elise to talk a little bit more about the required summer visits.
Thanks, Stephanie. So one thing that's unique about our online program is that we actually consider ourselves 90% online, not 100% online. And the reason being that while the vast majority of your coursework will occur online asynchronously, as Stephanie mentioned, we actually build out 2 on-campus visits as part of the required curriculum. So this program, as Stephanie mentioned, is a little over 2 years, and that includes summers. And during each of the summers that you're enrolled, so the first summer and the second summer that you're part of our program, you'll come to campus for usually around a week, 5 to 7 days. And essentially, our program puts on a big conference style event for you. And most of our students consider this the highlight of the program. We bring in guest speakers. The faculty will lecture in person that week. We build out networking events. We have these incredible anti-racism trainings that we do. We have some fun social events for you to meet your cohort. There's opportunities to have lunch with faculty. It's really just a very it's really fun. We as staff and the faculty of the program, we enjoy meeting all of you in person, but it's also a really great opportunity to connect with your cohort. We've had folks, meet their classmates and end up jointly applying for grants together that they've successfully been awarded. I mean, it's kind of turns into this really great incubator as well for our students to connect, and you're really meeting peers in your profession as well. So they are, again, 5 to 7 days. You're once in your first summer, once in your second summer, and again, considered usually a big highlight of the program. So back to Stephanie to talk a little bit more about what the curriculum would look like and your schedule as a student.
Yeah, so essentially within the fall program timeline, I'm just using this as an example, even though we have 2 intakes. The fall program timeline, as I mentioned, is 7 semesters. So during your first 2 semesters, courses follow a full term 15-week schedule. So essentially, this allows you to adjust to graduate level coursework. You may be, have taken some time away from school and just re-entering the academic space again. So we really parse this out to help you just get a better understanding of the learning format, balancing your school, work, and personal commitments. And essentially, starting from your summer term, this is when the summer visit Elise mentioned happens, usually in June. But starting in your third semester, courses will move to an accelerated 6 to 8 week format. So you'll still be enrolled in approximately 6 units per semester, so 2 classes, but the courses are taken consecutively, meaning that it's one at a time, and they're shorter, more sessions, I should say. The structure is very intentional, and it's just an opportunity to give you time to build your foundational courses, your understanding, and then help you steadily progress into the remaining time with our program. So if you're intending to make no changes to your schedule, the first pathway would be 2 classes a semester, and you complete the program in 7 semesters. If you are interested in exploring other pathways, we can allow students with approval to finish within 24 months. So that means as second year students, you can increase your workload to 9 units. That means you're taking 3 classes instead of the standard 2. And then if you need to take a pause in the program, you may also consider that. We allow students to complete the program up to 5 years. So there's different pathways in terms of completion time. But going back into the last slide that I mentioned, first year is all fixed schedule. We assign the courses to you. We use this time to explore. And then in the second half of the program, we focus more on concentration specific. So your health policy management courses, your elective courses, and then graduate. So I'm going to pass this along to Bradley to highlight more about the residential program. But before I do, the last thing I should also mention is our program between the School of Public Health is very flexible. So if you're interested in perhaps taking as an online student, perhaps interested in taking 1 or 2 classes in person, you may also consider that within the second year of the program. So if that's something of interest where you're primarily an online student but want to explore taking a health policy course, if there's seating available, we will completely be open to that.
All right, thanks, Stephanie. And so if we go to the next slide. And so within the residential MPH program, specifically for those interested in health policy and management, there are 3 on-campus options. There's the 2-year residential MPH. There is a 2.5-year MBA MPH. And so students who are interested in that must apply to both the Haas School of Business and the School of Public Health and get admitted into both departments to be considered a dual degree. We also have a Master of Public Policy and MPH degree, which students can take 2.5 to 3 years to complete. And so there's a lot of different options and avenues should a student maybe want to pursue their degree in person and perhaps maybe lean a little bit more on the business side or even more on the policy side as well. And so if you have questions, feel free to reach out to me about that. For this particular time, I'm just going to mainly focus on the 2-year residential for those only interested in the MPH. And so for our degree, it is a minimum of 48 units. And I say minimum because students may choose to take more. This averages about 12 units a semester. We don't expect our students to take more courses in any term, but some may do out of pure interest and academic curiosity. Our students pay per semester, not per unit. And so that for some, they may look to additional courses, maybe perhaps when the other courses are maybe a little bit more manageable, time management wise. Our students do have a 10-week full-time summer practicum between the years 1 and 2. And then there is some flexibility to take outside of your required courses, such as the ones listed here. Which for some of the options, you have a menu to choose from. Students may choose to take additional courses or to take their elective courses within the School of Public Health or within a different department on campus, such as the Haas School of Business, Goldman School of Public Policy, the School of Social Welfare, and so forth. And so if we can go to the, well, actually, and so for this, you can see the types of courses that our students would take to satisfy different criteria, such as for a policy course, students have a menu and options for those maybe leaning more towards on the global health side, or maybe perhaps biomedical innovation. We most recently offered a course starting last year on immigrant health in the US with one of our newest faculty members, Jenny Guadamus. We have health economics, economics of population health. And so there's a variety of different options that our students can choose to take their courses. Next slide, please. And so for those of you who may not be familiar with the Bay Area or maybe relocating, or maybe just want to live on campus, there are just some graduate student housing options that sometimes we get asked about, like what does housing look like for UC Berkeley graduate students? And so there are some housing options that are graduate student only, so not near the undergrad dorms. But so there are some graduate student housing options. There's also some housing options in Albany, which is known as University Village, which is more specifically for those with dependents or with partners. And so if you are relocating with a family or with a spouse, there are university housing options available to you all. Some will come furnished, unfurnished. And so there's just some pictures of different housing options that are available to students. Next slide, please. And so, and it just with balancing academics with recreational and well-being, there's the RSF, or the Recreational Sports Facility, which is basically the campus gym that is included for some of the current UC Berkeley students. And so they do fitness classes, they have pools, tennis courts, intramural sports. And so just some of the exposure that students would have. Next slide. And so getting around, a question might be, how do I get around? I don't have a car. Do I bring a car? So there's a variety of different options. And starting this year, actually, students can take a variety of public transportation for free as being a registered UC Berkeley student, if they are the on-campus model. And so you could take BART, which is our local Muni or metro system. AC Transit is our bus system. There's ride sharing, biking, and so forth. So just a variety of options to get around in lieu of having to purchase a car or bring your car. And next. And so, and just being a UC Berkeley student, in general, you are near, a lot of destinations that folks come all around for. So there's San Francisco, Napa Valley. So there's wine tasting on the weekends. Or if you like hiking or the outdoors, there's like Tahoe, Yosemite, Monterey, and so forth. And so there's a lot of different options available to you all. Next slide. And so just at a very high level, just including just some costs, just so you can kind of see what, if you, for our program, if you are considered a California resident, you would have, your fees would be the left, so that's what the residents would be. If you are a non-resident, so if you're coming from out of state, or if you're would need maybe an international student, your fees would be on the right side. And so in general, what you could see, a new student starting our program for this current year was about $24,000, and a student who is a California resident who started this year was just shy of $18,000 per semester. All right, next slide. And then I'm going to turn it over to, I think, Elise, who will kick us off.
Thank you. Yeah, so we know that funding your degree is one of the major considerations as you're planning for graduate school. And there's a variety of ways that our students might pay for their degree. So the first option is the self-funded route. So some students are able to cover the full cost of the program themselves out of pocket. If you're pursuing the online modality, our students typically are working full-time while they're in the program. So being self-funded might be a little more doable, because again, they're working full-time and not missing out on income if they're doing online. If you are going the self-funded route, there's the option to apply for a fee payment plan, and this would break down those semesterly fees into 5 monthly installments. A very common tool that folks use to help pay for school is tapping into federal student aid. If you aren't sure if you want to use federal student aid, we still encourage you to complete your FAFSA. It's the free application for federal student aid, and it's great to fill out, again, even if you aren't sure if that's something you want to use, just to see what's available to you. I will say that at the graduate level, federal student aid typically is unsubsidized student loans. So definitely look into that. But again, it is one of the most common ways that our students pay for school. If you are tapping into student loans or federal student aid, some eligible folks have the opportunity to convert some of those loans into work study, which would allow you to hold a position usually on campus, and there's a number of remote positions as well. So this is an option for online or on campus students. And again, you'd be doing some part-time work and rather than having that be a loan amount. This next item, public service loan forgiveness. This is sort of ever changing. It's often very much tied to our current federal administration. And so, it's best to definitely look into what's available at the time that you're interested in pursuing public service loan forgiveness. But if you are working in a nonprofit or a government role, it's possible that you may be eligible for public service loan forgiveness. So something to explore. The next option, we highly encourage everyone to look into employer sponsorship. So if you are someone who's working full-time, or if you intend to continue working while you're in school, definitely check to see if your employer offers any sort of tuition benefit or tuition reimbursement. We have a number of students who are getting some of their fees paid for by their employers. External funding. So highly encourage everyone to check out scholarships that might be available. ASPPH is a great resource. They've compiled a lot of different scholarships that are specific to public health. I always tell folks to check local as well, see if your community offers anything, if there's any affinity groups that you are a part of or clubs that you participate in, check to see if they might offer scholarships as well. So definitely do some digging for external funding. And then lastly, if you're interested in the Online MPH program, we do offer the Dean's Health Equity and Leadership Award, which covers around $11,000, and we award that to 3 students each term. All right, so we're going to talk a little bit about admissions. And you'll see we've broken down on this slide admissions requirements that are applicable for both of our programs, and then some of the admissions requirements that are unique to the online program and the residential program. So I'll start with an overview of what is true for both the online and the residential program. So if you are applying to a graduate program at UC Berkeley, you do need to hold a bachelor's degree prior to applying. And we do have, or I will also say, if you're completing your bachelor's degree, if it will be conferred and complete before you start the program, that would be acceptable. And UC Berkeley also requires a minimum GPA of a 3.0. Now, that doesn't mean you can't apply if you don't have a 3.0. Definitely meet with someone from one of the admissions teams, Stephanie or myself or Lori from the residential side, if you fall below a 3.0 and you want some tips on how to make your application competitive. But generally speaking, UC Berkeley is looking for a minimum 3.0 GPA. And then both programs require that you show us your CV or resume with your work, volunteer, or research experience. Both programs require a statement of purpose and a personal history statement. So definitely note that UC Berkeley requires 2 distinct essays. We know some programs only require 1, but we have 2. We require 3 letters of recommendation from either professional or academic sources. And we do need transcripts from every institution you've attended. So if you did community college and then transferred to a 4-year, we need both of those transcripts. If you studied abroad, we'd like to see those transcripts. If you did a couple different schools or took a gap, just make sure that you're sending us all transcripts from every institution you attended. And then lastly, if you completed your bachelor's degree or your undergraduate degree in a country where English wasn't the primary language, then we may require an English language proficiency exam, either TOEFL or IELTS. So definitely look into that and check the minimum required scores for those exams as well. I'll cover the unique features of the online MPH application process, and then I'll hand it back to Bradley to talk about the MPH. But for the online program, we do not use SOFIS. So some of you might be familiar with SOFIS, which is a centralized application system for a number of public health schools. The online MPH program does not use that tool. We just use what we call the UC Berkeley graduate application. And this is a general application or an application specific to UC Berkeley. And there is an application fee for that. It's $135 for domestic students, $155 for international students. And we also look at your advanced GPA in our program. So we won't just look at that 3.0 overall GPA. We'd actually like to see your GPA from your last 2 years of undergraduate. We found that many folks have sort of an upward trajectory in undergrad. And so we like to look at that advanced GPA or those last 2 years to see if there was that upward trend in your academic career. We also require that you've completed statistics or a college level math course with a B+ or higher. This is because our program, like most MPH programs, but definitely with the online MPH, we have a really quantitative heavy first semester and first year. You'll be taking your epidemiological methods course, your biostatistics course. So, we're not trying to create barriers, but we just want to make sure that you're set up for success. So having that stats or math course is really important. If you completed your undergraduate internationally, we do accept WES ICAP evaluations. And then just a few notes, we are currently accepting applications for our fall 2026 term. We have 2 deadlines, a priority deadline of January 5th. Priority is always great to shoot for. You'll hear back earlier, way better for your personal planning. But you actually do have until March 2nd to submit an application that would be considered for fall 2026. And then if that's too soon, if you're in the really early stages of exploring, our program actually has fall and spring starts. So you can also consider spring 2027 as well. And Bradley, would you like to talk about the residential side?
Yeah, so in addition to very similar requirements such as CV, resume, and so forth, students who are applying to the 2-year residential would need to apply through SOFIS. And your SOFIS application would then, once you applied, it would launch a UC Berkeley graduate school application. So there's essentially 2 fees that that an applicant would need to pay who is applying to our program. And really just the big thing is that to really note, we do only have 1 admission cycle. And so 1 admissions deadline, which is December 1st for the 2-year residential. So, and it's 8:59 p.m. Pacific Standard Time. And so you want to make sure that you get your materials in and pay the application fee by that date, if not sooner.
Awesome, thank you. And we just sort of wanted to close out with a side-by-side comparison, some of the key differentiating factors between our 2 modalities, online versus 2-year residential. So we can start by some of the similarities or the things that are shared. Bradley mentioned this at the beginning of the session, but many of the courses for both the online modality and the in-person option are taught by the same faculty. If you're doing health policy and management, the majority of those classes are going to be taught by this, the same faculty member who's teaching that class in person is going to be teaching the online component as well. And I'll say we often even have some residential students, on-campus students taking the online version of that class because it works better with their schedule. So we definitely see that overlap because again, it's really the same course taught by the same UC Berkeley faculty. Both programs offer networking opportunities. So Bradley also highlighted a number of these that are available through health policy and management specifically, but also just by being a UC Berkeley student and a Berkeley Public Health student. Again, career and campus resources are accessible to our online students and our residential students, things like the D-Lab, the RISE office, who offers career support even after you graduate, the campus health services, all of those things have online and on-campus options that you can take advantage of. Specific to the online program, again, we are a 42-unit program and we span 7 semesters. Because it's part-time, it's 7 consecutive semesters. So fall, spring, summer for 27 months. We've broken the cost down by semester. So for the online program, it's $10,000. This is an estimate, but a little under $11,000, excluding the health plan, which is what the majority of our online students do because they have health insurance through their employer. And we do 2 admit terms per year, fall and spring. We overall recommend the online option if you're a working professional or you have a number of outside responsibilities. It might be caregiving responsibilities, or you're just a person who's outside of the Bay Area and you either are unable to or wouldn't prefer to relocate to the Bay Area. So if any of those or a combination of those are applicable to you, then we highly recommend the online option. And Bradley, would you like to talk about the residential side?
Yeah. And so for our program, just to kind of highlight, so we are the 48 minimum, which is about 12 units a semester, which is considered full-time at UC Berkeley. And so over 2 years, 4 semesters, our students will earn their degree. The estimated semester cost for a California resident is just shy of $18,000, including health insurance. Many of our students do have the health insurance through the university. Now, if you have a very similar health insurance already, or maybe you prefer to keep your health insurance that you already currently have, maybe through a spouse or some other means, that would be something that you could choose to opt to waive. And the university health center is the one that will review any waiver requests to ensure that you have adequate or very sufficient coverage that would be on par with what the university offers. Again, we only admit for fall. And so those applying right now would be starting for fall 2026. And so we do not have a spring admission cycle. And lastly, just kind of who might pursue the on-campus version are those interested in pursuing a degree full-time and in person. And so for those who maybe are looking to relocate maybe to the Bay Area and you want a reason to come out to California or come out to San Francisco Bay Area, then this may be a nice option for you. But ultimately, we hope that you take all the information that we share and meet with any one of us to really talk through your plans, your questions. If you're interested in chatting with current students, really just to help you all make the most informed decision as you decide where you would want to earn and receive your MPH. And we hope that UC Berkeley, whether online or in person, is where it might be.
So as we close out, there's a few ways to contact us. You can reach out to us directly via email, which our online team is online.mph@berkeley.edu. It goes directly to us. So please reach out with any questions there. For the residential side, HPM_MPH@berkeley.edu. You'll get direct access to Bradley. So you can book an appointment with us. These slides will be provided to you as well. And we encourage you to follow us through our socials. This is where we are excited to post any upcoming events or just latest things that are happening, so new innovations. But with that said, I'm going to take a pause on this recording and open this up for questions. And thank you so much for joining us this session. I hope that it's been very helpful for you to explore at any stage that you're at.